Government of Goa, in association with the Federation of Obstetric and Gynecological Societies of India, will be starting treatments for infertility at the Goa Medical College and Hospital in the near future. A team from FOGSI will be providing training to the GMCH doctors so that the Obstetrician and Gynecology department will be able to provide treatment to childless couples.
गोंय राज्यात एक नवे तरेची एक योजना फुडें व्हरपाचो आमचो प्रयत्न जाल्लो आसा. एक म्हणजे कितें जाला की इन्फर्टिलिटी ट्रीटमेंट आनी इन्फर्टिलिटी आमची महिला जी आहा गोंयची महिला खूबशे लोक गोंया भायर वयता ट्रीटमेंट घेवपाक आनी तांकां भरपूर खर्च जाता की ह्या तरेचो खर्च जाता की 5 लाख पासून 9 लाख पर्यंत तांकां त्या तरेचो खर्च जाता आनी आउटकम समटायम्स इज नॉट एज एक्सपेक्टेड. FOGSI is a organization, definition Federation of Obstetric and Gynecology Society of India. She is going to take over now. And I was very happy to meet her yesterday because she has said that this is a member associated to more than 241 societies and also 35,000 obstetricians and gynecologists spread over the country. I had a long detailed meeting with her. This is why I said we should, before I went, this is not because I met her, then we are having this press conference. Before I went, we had a detailed meeting with Dr. Guruprasad Pendekar and Dr. Ajit Nagarshekar and Dr. Muriel. And आम्ही कितें करूंक सोदता की हे डिपार्टमेंट आम्ही ऑलरेडी आमचो प्रोसेसान पायपलायन आहा टू बिल्ड अ मदर एंड चायल्ड ब्लॉक एंड तेज्यान हे इंटिग्रेट जावपाची गरज आहा. आमची इतली गोंयान महिला आहा they because and for their sake what is for beneficial to these ladies who actually who spend their hard-earned money and going out of Goa, and we don't want them to go out of Goa. So IUI and IVF चे दोन ट्रीटमेंटाचे दोन भाग आहा. Success rate is similar. So what we are trying to do is we are going to try to introduce IUI in Goa Medical College immediately within the span of 30 days. Whatever infrastructure त्यांची actually meeting आम्ही आपोवपाची आहा with GSIDC तांकां जे कितें infrastructure लागता and त्यांचे कितें तरी गव्हर्मेंट ऑफ इंडियाचे त्यांचे ICMR गायडलायन्स आहा ते एडिशनल इन्फ्रास्ट्रक्चर. सो IVF treatment in Goa Medical College, IVF will start after a period of between 4 to 6 months. So this
IUI is intrauterine insemination and IVF means in vitro fertilization. These are both methodologies of assisted reproductive techniques. IUI will start immediately within about 30 days time. Here what we do is we take the semen sample, that is of sperms, we treat it with media and then put it directly in the uterine cavity. So there are certain indications where IUI works of infertility, and this cost treatment of IUI is much less. Afterwards we are going to start with in vitro fertilization, and it is coupled with embryo transfer. In vitro fertilization means we take the male gamete, that is the sperm, and the female gamete, that is the ovum, fuse them in the petri dish. So the conception is outside, and once it reaches a certain stage, this embryo is transplanted inside. Now both the modalities have got different indications, and both the modalities have got similar success rate, like it is about 30 to 40%.
आणि आता डॉक्टरांनी जे तुमकां सांगला दोन्ही जे पार्ट 1 पार्ट 2 आम्ही जे करपाचे आहा and आमचे गुडविल आमचे we were lucky that she has assisted Dr. Nandita Palshetkar, who is now going to take over as the federation as the head of the Federation of Obstetric and Gynecology Society of India, FOGSI, from 2019. She has assisted Goa Medical College. She said we will give full free service to Goa Medical College. They will give the full backup and handhold us till we set up this facility in the state of Goa. I don't think there's any other better body than this who can help us. And Goa government is happy to have a tie-up with her and her body that will help us set up this type of good top-class facility. And she herself on her own has got about 9 to 10 clinics in Bombay. Plus she is doing a lot of social activities. Then this is a very professional body. And apart from that, there are several NGOs she is working with in Maharashtra. And within the 4 to 6 months period, we will start IVF treatment in Goa Medical College. But हे सगळे in association with the FOGSI and with Dr. Nandita Palshetkar. And she is ready. She is happy to send her team to train our doctors and to help handhold us till this whole setup is on track.
Infertility around 20% असता. So out of this 20%, some of them conceive with lower modality of treatment. Infertility treatment always is from lower to higher modality. Like आम्ही महाभारतान ब्रह्मास्त्र म्हणता ते लास्ट म्हणता, तसेच IVF म्हणता ते लास्ट, that is the highest modality of treatment. So out of this 20% which come to us, maybe half of them or about 30% of them may need this higher modality of treatment. And this higher modality of treatment is very expensive. On an average, one cycle costs about $1 lakh on an average. It may vary from anywhere from 60,000. Some IVF centers may charge you about 1.2, 1.5 lakhs. But on average, we consider 1 lakh. Now the problem is when you go for IVF, we always tell them that you don't go for one cycle, because one cycle you may not get the result. So you have to be ready to go for at least 3 cycles.
For me, it's a two kind of strategy. One as a health minister, second as a minister for women and child, and something that we can do to the women to provide them so that they don't lose money, they don't have to go out of the state of Goa. आणि काही कडे कितें आसता रिस्ट्रिक्टेड फेसिलिटी अवेलेबल आहा ते गोवा मेडिकल कॉलेजान जावंक जाय अँड टू हॅव समबडी हू इज हेडिंग दीस टायप ऑफ अ बॉडी टू हँड होल्ड अस म्हणजे कोण तेजेर प्रश्नचिन्ह घालू शकना जेन्ना ऑल इंडिया बॉडी जी आहा हे नंदिता पालशेकर त्यांचे कडेन संपर्कान रावन आमी ह्या तरेची फेसिलिटी गोवा मेडिकल कॉलेजान स्थापन करपाचो आमी निर्णय घेतला.
ब्युरो रिपोर्ट, डॉन बॉस्को चॅनल.